Hi, everybody, and welcome this evening to this edition of Victoria Seaton Goes to Work. Today, y'all, I'm gonna be a surgery operator. I'm gonna do virtual surgery on this video game today. And if you love these videos, if you like these videos, if you love me who's creating and playing these video games and creating and producing this content for these videos for YouTube, go like, be the first to subscribe, be the second, third, the fourth, the fifth. Grow the subscriber count to the Victoria Seaton Gaming channel. Like me on Twitter at ThickBombThick. There it is, everybody. At ThickBombVic. Follow me on my Twitter account at ThickBombVic, or just simply type my name in. My first name is Victoria. My last name is enunciated, pronounced Seaton. Type it in on Twitter. Type it in on your app, on your telephone, your smartphone, your iPhone. Type it in on the computer. Type it in on your tablet or your iPad, anywhere on Android, iPhone, or a tablet or smart television devices, wherever and however you can get access to social media and to Twitter media. Type my name in, follow me, like my videos, my posts, message me, give support if you love these videos, these video games, and I will keep them coming for you. And be the first, or be the second, be the third. Grow the subscriber count and support Victoria Seaton Gaming, for it will be here for years. Whether you can laugh at it, you can learn from it, you can grow from it. If you thought it was educational that you look at my videos, if you thought it was comedy and it made you laugh and it gave you happiness today, it gave you the spirit of joy, then go over, type in Victoria Seaton Gaming on every device you have, with every family account you have, with your friends account. Type it in, subscribe, like the videos, check out the content. That's all I have to say. And y'all have a great day. And we're about to get into virtual surgery. Virtual surgery. Because Victoria Seaton goes to work, because we got to make this money. So y'all, today I'm a surgery operator. I'm a surgery operator. So here is the entrance screen. It says, welcome everybody to virtual knee surgery. Welcome to virtual knee surgery. So y'all, I'm in this hospital environment. We have some people that might not be so well, and they need me to recover them and for them to survive the Victoria Seaton surgery operation. Do you think we can do it? Do you think we could save a life? Do y'all think I can save a life out there? I think I can. So I'm going to start and press the continue button. And here we go into the world of healing, into the hospital environment. And welcome to the virtual hospital. Welcome to the virtual hospital, and welcome to the Victoria Seaton Gaming Channel experience, where you get to experience watching me, Victoria Seaton, play these video games, and you get a different experience every single time around.
Welcome to virtual knee surgery. This activity will show you the process of replacing a failing knee joint. Are you ready? Today, our patient is a 76-year-old man.
He's 76.
It is mandatory to check the patient's vital signs before beginning surgery. An anesthesiologist in the operating room performs this step. If the patient's vital signs are not in the normal ranges, we will not proceed with the surgery. Using the healthy person's vital sign chart as a reference, can our patient undergo surgery today?
So I have to interact. I have to give an answer. I have to use my intelligence. And I have to make a comprehensive, intelligent, decisive thought process. I need to analyze all the information on his medical chart that they have on the patient to know if he's healthy enough for surgery. Then I have to give a pretty good vital answer that the doctor or that the nurse is asking me to approve because I am the surgeon. So I can click yes or no on the charts. The temperature is at 97 to 99. That's what would be a normal person, a healthy person's vital signs. The heart rate is 60 to 100 beats per minute. Blood pressure, systolic and diastolic blood pressure. So that's just two types of blood pressure, just numbers that they're looking for. Make sure the blood pressure is not too low or too high. And that the pulse oxygen level in the body is at a regular frame. That's all that they're looking at a good percentage. It's making sure they have good blood flow, good oxygen, they can breathe, that they have no fever, no pneumonia, or no signs of infection in the human body. That's what all this was. All of that medical jargon up there. And it says our patient's vital signs that we have here is he's at that range where it's healthy, temperature at 98.5, heart rate of 75 beats per minute, so it's healthy. That means it was no athletic activity. The heart rate at resting time with no physical activity or athletic movement is at 75 beats a minute, so it's healthy. The blood pressure is had a healthy level. On systolic, it's below 150, and then on the diastolic blood pressure, that's just another type of measurement they're using. It's below 100. So on both levels, they're just letting us know it's not their blood pressure is not at a poisonous level. It's not at a dangerous level, and that it is below 150 and 100. So they'll say like in a hospital environment 150 over 100. So it'll be 120 over 85 here for the patient. So it's healthy. If it was above if it was at 150 or over 100 or above, it'd be at a dangerous level. Then if it's too low, that's the dangerous level. They also have another measurement for that too, or if it's too high. Because if it's too low, if your blood pressure is too low, you're near death. That's what that means. And if it's too high, you're near death because your heart is beating too fast. Your oxygen and blood flow is too fast. So it can never be too fast and it never can be too slow and too low. In the oximetry of the pulse, that means the oxygen running through the veins is at 99%. So he's getting good oxygen level. So for the risk, this is my Victoria Seaton's explanation, because I have to explain it for first time viewers if they have no knowledge about how a nurse analyzes the patient and how do they know if they can undergo surgery of any type, if it's life threatening or if it's cosmetic or if it's a surgery that will benefit a patient's life overall. If they had a small injury, whether it's chronic or acute, long-standing or short term, because there are particular surgeries patients need, they desire, but they need it because if they're not having it or if they refuse to, they might develop an illness in their body, or when they get older or elderly, or they develop a worse condition as a result. If they started off with healthy blood pressure, it might not be like this when they're middle aged or elderly. Or they may suffer damages in their muscles, their tendons, their joints, or develop a form of a muscular disease or a bone disease. They may have multiple conditions underneath just, being healthy and eating a plate of protein and vegetables. That's when a plate of healthy food is not fixing overall what is the problem or the issue in the patient's body. So if they might have to undergo a surgery or to get or undergo special treatment. So that's my answer. So it's asking, can the patient undergo a surgery? Are they healthy enough for this? I would think yes. Their temperature's good, so that means if they went on the table, they would not die or develop extreme pneumonia after the surgery. Um, their heart rate is at a regular level, so that they would not die on the table. Their blood pressure is not too low, so I would not ever have to risk putting them on a monitoring medical machine to keep their heart rate pumping blood. So I would think yes.
It looks like surgery will proceed as planned.
So we're proceeding.
Take a moment to look at our patient's x-rays. Which knee do you think needs surgery?
So we're looking at both knees. We're looking at two of these x-rays. I'm thinking that it will be the left knee of the human body of the patient that we need to proceed on. The bone, the muscular tissue in one of the knees looks like it's corroded, that it is completely eroded and it's not there. And it's in the left side of the knee. The other side, the upper right side of the knee looks healthy. The muscular tissue, the joints and the bones are stabilized. They're equal and at equilibrium on both sides. There's no imbalance there. So the patient has no pain, most likely in their right knee, so it'd be the left knee. The tendon, the muscle, the joint looks like it's in pain. It creates inflammation, which that's a sign of pain in the body. And the nerves are sending signals to that left knee to put it in pain, to let it know that the bones, if the bones are crushing one another in one of the knees, and if the tissues are not, or they are no longer protecting the left side of that knee, and it's not stable, and the bones are pushing on one another, it's creating a pain in the knee of the patient. If they have to do an athletic exercise, if they have to walk, if they have to get up and do everyday chores. So I would think this knee.
You're right. His left knee appears worn down and lacking cartilage, which is likely the cause of his pain. The nurse has begun prepping our patient for surgery by placing an IV needle in his right hand. Now it's your turn. Use the marker and write your initials on the proper knee to be operated on. This may seem silly, but it's an actual step taken to prevent wrong site surgeries.
So I have to grab this out of the I'm not gonna name it this toolbar. I'm gonna name it out of my off of my medical tray. This is what I have to grab off of it. You know, because if you're in the hospital, it's a medical tray. They're gonna have every single tool laid out for that nurse and the surgeon, and and only the surgeon can pull out particular tools that he or she is authorized to use. So I would take this, and it says I can write the initials on the patient's left leg. So I just have to go and mark around the leg. So this would be the left side. So it would be here. It would be the left side. If you see how it is on the screen, there's the left side and the right side. But when you look at a medical chart, the left side of the leg looks like it's the right side of the leg. It always looks like it's the opposite. But when you put a human anatomy, like the human anatomy of the body, on a piece of paper, the left side of the leg is what most women and men think psychologically. They think it's their right leg on their body. for those that maybe never thought of it, if it slipped their mind, or if they get confused when they think about it. So I'm going to put
Nope.
these.
Nope.
It's going to let me do it.
The anesthesiologist administers drugs through the IV and through a mask over the patient's face. What function should these drugs perform?
He wants me to tell him what anesthesiology is for and what an anesthesiologist doctor is for and what they do and what they have a degree, an educational degree to do, and what type of medicines that they are licensed to use on a patient. It's to make them sleep, to make them live, but it makes their brain shut down for a little bit so they can sleep, so that they lose feeling in different parts of your body and nerves, so that they can be cut on without killing the patient. Because if they feel all of that pain physically and psychologically, they would not survive and would not be able to be still during a surgery, no matter what type of surgery it is. So what functions should it perform? It's all three that is asking me to, what do I think it is? A paralytic agent. It means us asking, do I think that it's used to paralyze a patient to keep them from moving? That's what anesthesiology, that's what that is for. Um, you never want the patient to wake up while you're in surgery. That's bad. If y'all are surgeons or y'all are nurses, or you are like, if this is your job, if this is your real job somewhere, you never want your patient waking up during surgery or right before you're about to start surgery. If they wake up, I'm telling y'all, y'all hospitals getting sued. I'm telling y'all. Mm-hmm. I'm telling y'all the truth. And their family, they gonna put y'all on the local and probably the national news. And your board of your hospital administration is gonna have to pay that family out. Luckily, if they live and survive that, and if they never die, and it might destroy whatever sense of healthiness they had before the surgery if they woke up in the middle of a surgery. So when y'all have a child, a young man, a woman, an elderly patient per se, if you have their life in your hands with that medical tray kit, you better make sure that you know who your anesthesiologist is and how long they've been practicing and what their experience level is and what their competency is, and make sure they've never had a claim against them, or that they've never been accused for messing up a past surgery, and if their patients woke up before or during a surgery. Because those are types of things hospitals have tried to keep secret before. And the last 15 years, There's been different patients that ended up on the television news to explain their mistakes in different states in the United States and in different countries. So that paralytic agent to keep your patient from moving, I think that's a pretty good one that I can check because I think it applies.
Good work.
It applies. He said good work. He said good work, Victoria Seaton, because it applies. Cause he ain't this nurse right here is standing in that blue outfit. He knows we're not trying to get our virtual hospital sued, and we're not trying to get our virtual hospital to go out of business, and for the state to stop funding us and to stop letting us get all that good medical insurance. If y'all know how they make their money, their finances, so that all those employees of a hospital get paid. So the state board lets them get paid and lets them be licensed to practice at a location. Because if they mess up one time on a surgery, the state board can go after all their license. I mean, everybody on the shift is like this. Everybody on the shift, one snap of a finger, because they have to make sure everyone is protected all the time. If they undergo surgery or medical treatments, they have to make sure there's no nurses or doctors or surgeons that are going around sabotaging, making too many errors or mistakes in procedure that they were taught to follow, and that they learned because it took them years to learn it, over 12 years, and to make sure they're not killing men and women or their children. Because that's not good. See, this is educational on the Victoria Seaton virtual knee surgery on the Victoria Seaton gaming channel. So then it says, what else do I think it does? I think that it kills pain in the body. Never get, I will say this, everybody. Never get an analgesic or anesthetic, or however you want to say it. Never get this confused for an opioid. Never get this confused for an opioid. Because opioids, people can take that and they can be wide awake and take opioids.
No.
And I clicked that just so everybody would know that Victoria Seaton knows what she's talking about. He said the answer was no. It's not for killing pain. So a paralytic, that's what anesthesiologist, anesthetic, that's what all it is for. I'm talking about these medicines for the surgery. It's to paralyze for a few hours and to put the brain and the muscles and nerves into a sleep. It's like a momentary coma. It's an induced state. Humans physically are forcing it and making this happen to the human body. This is not an opioid. This is not for relaxing you, making you feel high, to kill pain that you emotionally have, if you have some, from your past experiences and traumatic or PTSD. That's not what all this is for. So he said, no, the answer is no, with a red X through everything. What side effects does this drug do? It makes a patient oftentimes forget surgery. If a doctor asks a patient, if I, Victoria Seaton, ask my patient, do you remember surgery? Most times the patient will say the answer was no. They'll just wake up. They'll say that they felt groggy. They were just a little sore, but they never remember a scalpel cutting them. They don't remember they don't ever remember the pain of being stitched, back up. They never remember all of that, because that would create PTSD, and the goal of this is to destroy PTSD, not to give this to a patient so that they never have lifetime psychological and physical issues and injuries after, or post surgery.
Great.
So the answer was yes. Then it says, okay, it's asking me, do I think that is this an anti-inflammatory to prevent the legs from swelling? During a surgery, there are particular treatments that can be put in with a syringe to prevent swelling. Different heat laser treatments that also can prevent swelling. If it's an extreme surgery where there's going to be a lot of blood, possibly a lot of blood loss, medium to large. But is the paralytic agent, is that going to prevent that leg from swelling? Honestly, is it? Then it's asking, is it a relaxant to make the patient happy? Is it relaxing them to make them happy or not to be nervous? The patient, number one, they'll forget surgery because that's one of the side effects. The patient's not going to be moving during the surgery, so it's not to relax them to make them happy. A relaxant sounds more like an opioid drug. Like when you have a pharmaceutical drug, like if you take pills, if you take naproxen, if you take a Valium, if you take pills, that treat bipolar, schizophrenia, anxiety disorders, or temporary anxiety. That's a relaxant that makes someone happy. If they have emotional sadness, emotional pain, or just if they're never sad but they have anxiety issues, from time to time, when they get that through different experiences they go through in their life at different stages. So I would think, you want to see what it will say?
Nope.
No, because I just told you a syringe or a heat treatment therapy will be used, or a syringe and different medical treatments will be used, or heat laser treatments will be used to prevent the leg from swelling, and that's during the surgery and almost near the end of the surgery. It's the middle to the end of the surgery. They never start off using an anesthesiologist, medicine at the beginning of a surgery to destroy swelling, because they never know how good or how bad the muscle is going to react to everything, or how the tendon, how the tissue, how everything gonna look until they open up the human body to see what it is. The surgeon have to go into the body and by every stage of that surgery and the process, they have to see what it looks like. They get a surprise. They study the human body. They know what to expect, but they will not know until they open the body up to be 100% sure that their analysis was 100% good. that if that to know if it's going to be swelling or not from the middle to the end of the surgery. That's only they only know until after they use a scalpel and they open you up. Then after it says, is it a relaxant to make a patient happy temporarily? Well, yes, because I know it sounds like an opioid because it has something in common with what opioids do. But yes, it can make a patient happy because they will not die. they need, they will not die. They need anesthesiology to make sure they're not in so that they're not moving during surgery, so that they forget a surgery, so they don't have post-traumatic stress disorder and PTSD post surgery, so that they can so that their brain is never under extreme psychological and emotional trauma during and after the surgery and before the surgery sometimes. That is to make them happy so that they live. So they live happy. So the doctor never gets a telephone call that his patient is in a severe state after the patient went home. That's post and recovery 3 to 6 months after any surgery. There's some doctors that they tell after 2 months, at an earlier time. So I'm going to check mark relax to be the patient so the patient's happy. Because the patient has to be happy and their family have to be happy and they have to be healthy. That's the number one thing that a surgeon and a doctor and nurses, that's what they look for. To make the patient happy and healthy.
Fantastic. After the patient is unconscious, and before the first incision is made, we need to establish a sterile field around the surgical area. A series of sterile drapes isolates the surgical field from the rest of the patient's body. A tourniquet is applied to cut off blood flow, which allows a clearer view of the surgical field during surgery. To kill the bacteria on the patient's leg, clean it in a betadine solution. This scrubbing process will limit the chance of bacterial infection.
So we're going to put betadine solution on here. It's just to clean it up. If you've ever seen surgery television programs on the Learning Channel, it's going to give it this dark orange color on the outside of the skin once the solution is applied and put on there with a sponge. Is to make sure it's no infection or outside bacteria that gets in once we start the surgery and the patient is, cut up, once they're cut up. So grab a sponge from the tool tray so we can swab the leg with betadine solution. I put it in there. Over the leg.
The betadine scrub is applied 2 more times, followed by the final arrangement of sterile drapes. So, why do you think knee surgery involves so many drapes?
They've prepped it. So they put all these drapes around the leg after they sterilized it. So they're asking, why did they put those blue colored wrappings around the leg? Then they take a knife. It's a form of a knife, or it's these huge scissors. In the old school, they thought it was a knife. Then in the modern era of hospital surgeries, in modern surgery, then they use these huge razor scissors that can cut through absolutely anything, like a saw, and to take just a piece of the wrapping above the knee is to remove it, because that's what we need visible, because we have to do the surgery there. And it makes it look like a prosthetic, because that's what it is. So it's asking, why do we put so many layers of that wrapping around the leg, and we're only gonna see visibly just the knee, just the area of the knee, and that is all. So the answer is, it can protect, I think, a patient from hard to treat infections and to keep other bacteria out. Leg hairs. It can protect the OR from infection if the patient does have it. I think those are the two answers.
Good work. Use the sterile marker to draw the location for our incision. And don't forget to mark the perpendicular lines too.
But
typically, the incision line is 6 to 7 inches long.
But I would say that I clicked the good answer there. That means the best answer, the top answer. But we sterilized this leg. But there are different OR surgeons that they did give, like, there's an answer number, like, to answer A, answer B, and they think the other one is to protect them from an infection. Now they sterilized it so to destroy all the bacteria on the legs, but there's different OR surgeons that said that they have successfully sterilized and cleaned up and destroyed all bacteria on the outside of the skin, and they found infections, so they stopped surgeries if they thought it was so extreme that a surgeon might get it. And so they refused to go further in a surgery if they thought it was a danger to who operated. And if they found anything that was a rare infection that has to be studied, or they need multiple OR surgeons in there, or if they think they need to do other research or developments to go deeper into a surgery. If they think it's high risk, or they found an infection in the body that they never knew was there at first, after they have a medical report, then yes, they have stopped surgeries before on patients because they said the OR surgeon refused to catch what it was. Or if it's in the blood. Yeah. That has happened before, but they're not telling people that on a video game. Because that would scare them. Everyone has to know the life of a surgeon, because they have the secrets of medical research, a few of them. And it's about the experience that they have in the field to know what they have seen and some scary atrocities in the medical discoveries that they have witnessed. And they have stopped surgery on just a small number of people if they have an infection that a OR surgeon knew that they might catch if they did not get out of the room and to shut the surgery down. Yeah. So we're gonna go here, and it tells me I have to mark where the incision will go here on the leg. And yes, Victoria Seaton, am doing quite a bit of talking because this is an educational video. It is to enlighten, to make everybody learn about this. If they are one of these people that are asking 100 questions, because if I would have made this video and never said one word, there's people that will have about 25 to 100 questions about all of this. If they're asking someone to tell them verbatim in simple language what all this means. And if they're studying this in an educational program or institution or in a school at middle school, elementary level, or high school, or if they're getting ready for a nursing training program, or if they're getting ready for a medical program in college, but if they're not the brightest one out there, but they are learning from me from the video. So I'm there to help them out. And we doing this surgery, everybody, and giving them some educational wisdom that they can use to pass a medical examination. And if I helped you pass an examination or a test, or to know the vocabulary you needed to know, like the video and subscribe to the Victoria Seaton Gaming channel. If I helped you remember anything about medical vocabulary, jargon, or these processes, medical tests, or programs, like, give a thumbs up, subscribe. If you learned something that you might have forgotten, but something you used to remember, but that you need to succeed in high school, in college, in junior high school, in a medical program, and you need to refresh your memory one more time, this video, I hope it blesses you and gives you that.
What purpose do you think the perpendicular lines serve?
Oh, now this is a good question. This is a good question here. What purpose do I think that the perpendicular lines serve? That these straight lines serve that I wrote on the knees, on the left knee. It said a few options here. It's to help align the knee or to indicate which knee needs surgery. We all know that's not a good answer, because we knew it was the left knee. We already put the wrapping on it. We put the prosthetic on there, so we know what knee it was. So that's not the right answer. To increase sterility around the knee. Well, first of all, y'all would have to know what sterility is. Hold up, everybody. Y'all want me to tell y'all? So there it is, y'all. There is the Victoria Seaton definition. So y'all, if y'all ask, what is sterility? What is that? So you know how to answer this question with intelligence. This is my definition of what this is. Sterility is when your sexual chromosomes yield no fertility in the outcome. It prevents pregnancy, or it prevents vital sperm or vital ovaries. But it's more common in men. Different men, for example, in surgery cases, post-surgery, if they've ever been negatively affected, if they tested positive for being affected in their physiology, in the outcome, or in the growth of sterility. If they tested positive for sterility, that means that even if they had 3 or 4 children, but then if they had a surgery, then after the surgery, or because of the surgery, if it never was preventable, then if they had no fertility, if their sperm and chromosomes in them are no longer vital, sperm, the chromosome in the human body, is the genetic makeup of what creates a boy or what creates a baby girl in a pregnancy. You need the sperm and you need the ovaries. In most cases, men have experienced this. European Americans of Euro ancestry in the United States have experienced cases. And surgeons know this and have medical researched this and have proof of that study. They have went in surgeries. They tested positive after for physiology, makeup, decay. It means that they were losing their ability to procreate, and losing their ability to be fertile. So even if they had 3 or 4 children before a surgery, but then after about 1 to 2 years, or about 8 months, if they started having fertility issues, getting orgasms, healthy orgasms, if they went and tested to see, do they have fertility, did they test positive for a fertility issue? If they attempt to get their wife, their girlfriend pregnant, But if their genetic makeup of their chromosomes are damaged and it's yielding no fertility, that's what it will tell a doctor if they tested them at a doctor's office. And if they told them that it's connected to a surgery. Once again, this is never what you would like to hear after you went to the virtual hospital surgery. You never want an administration to have to take your license or bar you from practicing if you have been guilty of creating a faulty surgery outcome, and if this is what happened to a patient numbers of times. So this is what, that would be what is named as a medical scare, and that is not what the outcome of any surgery that any doctor or surgeon would hope for. They want their patient to be happy and healthy. So it has just for me putting a little black marker on their skin is asking, will it increase their sterility around their knees? Well, number one, now that you know the definition of sterility, this has to do with the lower abdomen, lower human body, for women, where their uterus is, all of their ovaries are, the inside of all of their fertility, where their tubes are and their vessels that protect their eggs and they give the flow of sexual reproduction. So that would not be where the knees are on the human bodies. It has nothing to do with knee surgery. If you're talking about a grown man, because we're operating on a 76-year-old elderly man, it has nothing to do with that. That would be connected to his lower abdomen. That would be below his waist level. So y'all know, because I'm keeping it, family friendly and educational. Below his waist. That has nothing to do with knee surgery. So no, it will not make him infertile if we put a perpendicular line on his left knee. It will not destroy his ability to make babies. If it was, it would be because he was 76 years of age. That would be the explanation. He's elderly. So if his opportunity to have babies was small, it would be because of that. Most likely, in most cases. But I'm Victoria Seaton. I'm here to tell you, if you have had knee surgery, if you know somebody that had knee surgery, I guarantee you can have babies. You can have babies if you are healthy, you're taking care of yourself, if you are before the age of about 60 years of age. Because it's elderly men, they're middle aged, above 50, and they're having babies past that age. That I know in my family or in the United States, past that age, and in other countries. I know other men and women in other countries that I've witnessed, they've had babies and they're above 50 and 60 years of age, and they're fertile, and they made sure they were with a fertility doctor and a specialist. And to make sure that their sperm is very healthy, their sperm count, and in their woman that they're asking to have a bit children with, that her ovary count is high, that her ovary count's high, and that she's 100% healthy. But if you've had a knee surgery, I guarantee you will never have a physiology or a chromosomal outcome of your chromosomes being completely destroyed. It will be vital. You will be able to have children if you have to have knee surgery. Just make sure that you did everything your fertility doctor and your specialist is asking of you. Never blame it on a knee surgery, because it never will correlate. It never will correlate. There is no connection. So it's time to answer. I've said enough, but I just wanted to let everybody know what is sterility if they ever asked this question or if they forgot what it was. Stertility is the opposite of vital for fertility, healthy fertility. I think it's between two answers. If y'all thought it was aligning the knee, or if you thought it was making it easier to match up the skin when closing an incision, because we have to open them up with a sharp metal object on that tool tray, a scalpel, and we have to know how to make it perfectly straight when we open it up, so we're not going to accidentally violate or to damage a blood vessel when we open up, or so that we don't go too deep into the skin, or so we don't put the incision into an area that should have been neglected, that we should have never put the incision inside of. So that's what that's for.
Outstanding. Now for the incision. Take the scalpel and cut the skin following your markings.
So I'm going to grab the scalpel here. So I'm going to slowly, I mean slowly, I'm going to take and open up this and create the incision on the top of the leg. Over the knee slowly. We want to take good care of the patient. And it has to be straight.
Let's use the Bovie pencil to cauterize the veins. This will help decrease blood flow into the surgical field.
Oh, so we have the veins and we have, the vessels. The veins is a vessel. It's just a smaller form of a tube that has all the blood in it. That's all that is. It's just for where the blood is, where it's placed, where the location is, and where it flows at. That's all it is. Grab the Bovie from the tool. There's men and women that used to think it was pronunciated the Bovi. Then there's men and women that thought it was the Bovie. It just too depends what country you live in and your accent, how you talk. I have no preference. So we have to categorize them. These are bleeding veins. This is to prevent and to stop the bleeding, the level of the bleeding. Because when you first open that leg up, it's blood everywhere. It's blood everywhere. And you have to stop it so that you can see how to go in there to see that where the bones are and where the tissue is supposed to be. And you have to be able to go in there to look at everything where you can see. You have to be able to see. So if you cannot see, and if all you see is blood, you have to clean it up. That's like first thing you have to do. On these areas. This prevents extreme blood loss, and it prevents that swelling in the knees.
The rake retractors fold the skin and tissue out of the way, exposing our patient's knee. To operate, we need the patient's knee elevated and bent so the bones are fully exposed.
So we can stop the blood, and we can only expose the skin properly, and so we can move it out of the area that we need to see. That's what that's for. It's so we can move the skin and know that if you ever go into this type of field, you can never pull that skin back too far or too little. It has to be like, you have to know your measurements. You have to know how to pull it back just at the right amount. Because if you pull it too far or not as much, you could damage a patient's leg and be in some serious trouble. Like, they will name you an amateur. So you have to know degrees, percentages, measurements. You have to know everything upon surgery or post surgery, or if they're training you for the first time on your first surgery, how to do it. And if you have other experienced professionals there helping you and watching you, and to show you that so you don't mess up on your first patient, if you have a first patient that you have to operate on. So that's why it's telling me they have to be at a 90-degree angle, because they know how the leg is going to look when you have to lift it up, when it has to be lifted up, and what it will do. But you never want to tear the leg open and to create a mess, or to tear up the skin and the muscles, because it has to be put back together perfectly with symmetry. Mm-hmm. So that the patient can walk for the rest of their life and have their skin connected on their legs. That's what that's for. That's cosmetic. The surgeon have to make sure physically and cosmetically that how it looks is appropriate. That they open the patient up, and they have to keep it in their mind that when they close them back up, the skin have to look as if, like, to make it look almost as if the patient never had surgery, so that they can go on living a normal life after that.
Now the leg is at the proper angle. Use the rongeur to remove the anterior cruciate ligament, or ACL, the meniscus, and any bone spurs that may be lurking about.
With minimal scarring. With minimal scarring, everybody. That's what I was telling y'all. So I have to get the next tool out. Now this is a tool that they call them the wrongs. The wrongs. You got to pull it out, the wrong. This is what they say what makes surgery right. So the people that say that, that if doing surgery on you was so wrong, I'm going to pull out the wrong, I'm going to make it right. Like, if y'all know the surgery jokes and everything. Because this is a tool that everyone have to use to make the surgery go good, to make it go right. So they have to go wrong to make it right. So if your bones was wrong, they pull this tool out and they make you right. Y'all know what it is? So now y'all know, if y'all, if you out of the loop, and if you never knew intelligent people jokes, I'm telling y'all what it was. Mm-hmm. We gonna cut it up so y'all can see clearly the shape of the bone was completely messed up. It was corroded. It's not in the proper shape, how it needs to be in a healthy man's body, because of his age. He's 76. 76. His bones are deteriorating. We have to fix this. Make it where he can live again with no pain. So he's not on a walker or crutches or a cane for the rest of his life. For the years he has left, so he can still be walking around and be active. That's what we're achieving. So I just took out the meniscus, and then I have to reshape the bone. So now I'm on the bone spurs, and I have to reshape it. The spurs is what's in the knee. It's what makes it where you can bend your knee, like when you walk. Bone spurs, like how you bend your knee. How you do squats, if you do bodybuilding squat exercises, or if you squat, or if you do yoga exercises or routines. That's what it's when you have to bend your knee and stretch out your thighs, your calf muscles, your quadriceps, and your butt. your buttocks muscles. It's to ensure you can do that. So that's where the bone spurs in the knees for. And that you can bend your ankles and your knees. Like, you got to be able to bend your ankles too. And your foot. So it's not all paralyzed.
Are you a good sculptor? It's time to shape the femur, tibia, and patella so the new knee components fit properly. A hole must be drilled inside the femur to set up the distal femoral cutting jig and alignment device.
So I have to drill a femur. I have to drill a part of the bone around the bone spurs. And what it's going to do is going to straighten up the knee how it needs to so it can properly heal and be fixed so that he can start walking straight with no pain. So he will not have knee pain, ankle pain, no pain. So he can be active and bend his legs appropriately at full 90-degree angle.
The jig is put into position and helps ensure that the cuts made to the bone are exactly what are needed. Now hammer in the pins to hold the jig. We can now remove the alignment device. The pins will hold the jig firmly in place. Now for some real bone shaping. Use the bone saw to cut the bone so it is prepared for the new femoral component. Another cutting jig, along with the bone saw, allows us to finish shaping the femur. Let's move on and shape the tibia. The tibial cutting jig is aligned with the big toe and the highest point of the tibia. This will ensure the leg is properly aligned after surgery. Secure the jig in place with more pins.
So we just shaved off, as you can see, a very, very thin. I mean, it's so thin, y'all. I know it looks like it's thicker than what it is when it's zoomed in on the video game that I'm playing for everybody. But this is a very thin piece of bone, and it has to it's has these screws drilled in it, medical tools. These are medical screws to keep it in place with that drill machine. Then what it is, they shave off a very thin piece of that bone that was damaged and that was decayed, that was making that improper shape and creating inflammation and pain, all in the nerves in the body. Then he shaves it off. Then we're gonna rebuild this. We're gonna rebuild it, straighten it out. We're gonna do what we have to do, and then it's going to recover and heal. So I'm going to continue and just watch. Just watch if you don't know any of the jargon on the screen, like all these medical words and vocabulary. Just sit tight, keep looking, keep watching.
Use the bone saw to cut off the top of the tibia and prepare it for the new tibial components.
Because these are the 3 bones that are around the bone spurs, around the knee. It's how you can bend your knee at a 90-degree angle. So it just told y'all earlier, the femur, it told you the 3 major bones that are in the knee. If you need to rewind the video and look at it one more time, it told y'all earlier 3 bones that are in the knee, if y'all were paying attention. And we're shaving all this off, all what was messed up, and we're giving it a brand new sculpture. A sculpture. We're bone sculpting. That's what we're doing. We're making it look like how we need to make it look, because the human body said, that it's not going to take care of the patient anymore. Mm-hmm. In his effort to be moving and to be active. So we just shaved
Now we'll
that.
use the patellar cutting jig and bone saw to remove the back of our patient's patella.
So now we're about to shave it and cut the shape from the patella. This would be the bone that is your kneecap. So when you put your left or your right hand and your fingers on your kneecap, that is what that is. So we cut the knee open, folded the skin back where the kneecap bone is. Inside of there is the bone spur. It connects to that huge bone at the top we just shaved there. If you look at the screen or if you look over here, y'all can see the two huge bones at the top. One looks like a huge metal, brick that we shaved. And then the piece of the bone that's beneath it, that's below it. So that's all we're fixing. It's a simple surgery.
Holes in the tibia and patella are drilled and chiseled out, which will enable the new components to attach properly. Time to place the trial components. First, attach the femoral trial component.
So we're going to continue deeper into the surgery. Now at this time, we're about 80% through the whole surgery, like 80%. I mean, these surgeries, this is one of the fastest surgeries that they've ever been able to accomplish. Like, we're at 80% through all of this. All they do is go in and bone sculpt and shape it, and they close it back up and heal it. That's all it is. If any of y'all out there are asking, what is this surgery? Simply, if I had to describe it and to tell you the Victoria Seaton definition of knee surgeries. So you have to grab the femoral component. It looks like a piece of rubber, but if you're in a hospital, this is a piece of metal. This is metal. Like, they made this. It looks like a piece of metal, but on a video game, it looks like a piece of plastic, like silicone. It's a special ingredient. Like, everything that all this is made with, like if you see the plastic spacer, the metal tray, the patellar, the femoral, all this is made to be compatible with the bones and the inside of the body as the surgery is continuing. So it takes a very special inventor for them, that they have to build and create objects for surgery that never are sold on the open market. This is what hospital administrations, they have to go out and they partner up and they have to buy these special, arrangements of surgery and medical tool objects, and they have to pay, a high dollar amount to get all of this, so this is a femoral component. This is especially for the knees. This is not most commonly, this is not for any other part of the human body. It's just for knee surgery. It's compatible for the femur. That is what all this is. This is what's going to go in it. It's like a prosthetic. This is what's going to heal it. It means if you messed it up, if you're in pain, this is what they going to put in it. This is what's going to heal it and give it the support. If there is no bones there, because you just shaved the bone, so it's fresh. The bone just was shaved. The patient cannot be in pain when they get out of surgery. They have to have some type of support in their leg because the elderly patient is missing support in their leg. And it's vital. That's what this recovery is about in the first place. So this is going to put it in there, this femoral component. It's just a piece of material that is humanly safe to go inside of the human body. That's all this is. And it protects it. Like if you had a wound that needed to be healed, they put a band-aid on it. If you broke your leg, they put a cast on it. They put a prosthetic on it and wrappings and bandages. They know what to do to hold everything together. They know what to put on it to make it heal. So this is the band-aid. This goes in the leg. And it's going to heal it and make sure no wound opens. To make sure the bones are not rubbing together. Because all this has to heal and make sure that this elderly patient has support for the next 5 years or so. All it is to heal the patient.
Attach the metal tray trial component to the tibia.
He about to get metal put in his knee to make his life a little bit better.
Insert the plastic trial spacer into the metal tray component.
And because he put metal at the bottom and he put the component at the top, he had to put the plastic spacer where you think he gonna put it, in the middle. And the kneecap bone gonna go on top of the plastic spacer. So in other words, they put this knee back together with human man-made parts and objects, and they put it in the knee, and then they're gonna close it up to heal this.
Lastly, attach the patellar trial component. Why do you think the two tibial components are inserted separately instead of as one unit?
So it's asking me, do I have knowledge on the materials that I just explained to everybody? So the question is, why does Victoria Seaton think that the two tibial components are inserted separately instead of as one unit? So why do I think that the plastic objects and the metal objects that are man-made, that are used to heal the muscle or to heal the bones in the leg, because all this goes back together. It's the bones, then you got the skin over it. All this have to heal all as one. The blood have to go back flowing where it is once all the surgery's over. And yes, you have muscles and tendons in your body. Yes. So it's asking me, when I put these objects in this man's knee, why did I not insert all of this? Like, why is it not created as one unit, like as one part? Or as a bigger piece where it all sticks together and you just put that one bigger component, one big piece into his knee? Or why is it inserted one at a time, separately, Why do we put it like that into his where his bones are, the patella and every single bone, the femur and every single bone in his knee? Most doctors, I think, would say this one. The plastic spacer can be replaced if it wears out without replacing the metal part. The metal object, if you put in the knee, obviously because of what that was man made in another century. That was man made. Like medical doctors have a businesses that make these parts so that they can do surgery using these objects to heal the human body when they do surgery. They make knee surgery possible. So y'all know what's the difference. And the plastic that they put in there. Hey, remember this one thing. After surgery, a surgeon has to do a follow-up examinations. I mean, multiple examinations when it's knee surgery, because they're going to have to rehabilitate this leg. They're going to have to make sure he can walk. They're going to have to make sure he has no nerve damage. They have to make sure that this patient 100% his blood pressure, oxygen level is at a healthy, normal capacity and range after the surgery. Up to 1 to 2 years. Some doctors say 3 years. If they saw some inflammation, if they saw slow progress on rehabilitation, if they see or if the patient went into the surgery with a hidden medical condition, even though if they're healthy enough for surgery, but if they have a medical condition can be because he's elderly, his age. A condition is a state of the human body. It's a state of the body. So sometimes it's not that he's sick. He's not sick. It's not the flu. It's not a cold. It never was pneumonia. This is the state of his body in the best condition possible where he can heal with absolutely no complaints. With where he will never test positive with any other side effects that went wrong or that were created, that showed up. So I would put this one to see what it will be. I think it's this one.
Fantastic.
Yes, that's
Conduct a range of motion tests to assure proper knee alignment and successful prosthetic fit. Typically, a normal range of motion allows the leg to move from 0 to 130 degrees. How does our patient's range of motion look?
So we have to make sure after the surgery that his leg can bend properly with the metal pieces in it, the metal component and the plastic component that we put in there. Then we close his kneecap, put it back on top with all those components in there to hold his knee together so he can bend his knees, he can bend his ankle. So they just making sure he can bend it at a 90-degree angle. A 90-degree angle is when he can lift his knee up. He can roll over. He can get out of his bed. He can sit down on the toilet. He can get in a bathtub if he's healthy enough to get in a bathtub. He can bend his knees and make sure that he will not stretch it out or hyperextend it or damage his knees. To put it back in pain, chronic pain, that means long-term pain. So he can live a regular life and do regular behaviors. So we're going to stretch it out. We have to stretch him out like yoga. And we have to see, how it looks. Because if the range of motion is not good after you put the components in there, swelling will happen. Swelling. Too much of it. There's going to be a little swelling in that knee because obviously it was just operated on. But if it's too much, there can be signs of other symptoms and issues that might arise in the patient. And that's what we are preventing in here. We have to prevent that. Mm-hmm.
Knees aren't meant to bend sideways, so it's important to determine whether there is a gap or space between the femoral and tibial components. There's no noticeable gap, so this knee is a good fit. Why do you think there are so many steps taken to ensure proper alignment?
I think the first one, we were talking and I was explaining the medical explanations prematurely about all of this. I think faulty alignment can produce complications for that patient if they go through rehabilitation, if they have to, if about their blood pressure, their oxygen, if they get anxiety in their body, if their nerves are being crushed, if their leg is not healing where they can use it when they have to rehab. What do y'all think will happen? Their blood pressure go up, their oxygen level, they're panicking, their nerves are sending signals off to their body that there's things wrong in their muscles and in their tendons. It's telling them it's in pain, it's not healing good, and it's in their bones too. That it might be rubbing together, it's not straight. There might be swelling on one side of where the muscles and the tendon and the tissue is, and not on the other. All of that can create a proper imbalance in the human body and could put them at risk for a life threatening infection too. If that patient, for example, if they lost their balance, if they fell, if they had a sudden pain that they never expected, and if they fell and hurt themselves, all of these type of things, the doctors, the Victoria Seaton administration, I'm looking at you. This is my administration.
Great! We've tested the trial components. Now let's remove them and prepare for the permanent components by applying a special cement compound that binds metal and plastic to bone. A scrub technician has mixed up a batch of cement for you to use.
I know what I'm talking about. Grab the cement from the tool. So this is what it is. They put the components in there first, all those objects, plastic and metal objects behind the kneecap to make sure that it fits in there. Then they stretch the leg out and bend it multiple times to make, I think 2 or 3, to make sure that it's stretched out how it needs to, that it's aligned. And yes, privately the doctors, they have to measure it. They will take out measuring tools. They have to measure it to know 100% to make sure that the leg is bending without the nerve sending off signals that it's in the wrong spots. That it will be pain post-surgery. Because if it is, they have to go back in surgery a second time. So they never put the patient in a life-threatening situation, because at that point they never can send them home if they knew that the leg or the knee was out of alignment. So what I'm doing is I'm putting the cement. This is surgical cement. This is not what goes outside that you use when you build or construct a public business or an institution around town. This is surgical cement. This is perfectly safe to go into the human body, and only surgeons can get access to this. This is for medical surgery. This particular cement, or if you call this green glue, the glue. but it's green. Yeah, green glue. You put it in there, and it's going to make sure the components stay in place where it needs to. Make sure that the bones are not rubbing together and that it never slips out of place when the components are in there. Make sure everything fits in there on perfect measurements. On perfect measurements, everybody.
With the cement in place, the final components are permanently attached to the knee. Any excess cement will be scraped off and thrown away.
Yes.
Lay the leg flat on the table so the new knee components put pressure on each other. This allows the bone and components to bond with the cement.
So it has to be laid out flat so that the green medical cement will bind together with the components in the knee. So surgery, we're at 90%, almost finished.
The cement can take anywhere from 10 to 15 minutes to harden.
Yes.
We perform our range of motion tests one final time.
Y'all already know. So now this is one of the final, this is when we're getting down to the final number of stretches where we have to make it flexible. We have to test it, see if it's flexible, if the range of motion up to 130 degrees. So we're going to stretch it past 90 degrees. So we're going to push the leg up where the lower abdomen is, up until the belly button where the middle of the stomach is. We're testing that. Slowly push it to see if it's aligned how it needs to after the cement was put in there.